procedure. The second reading debate is adjourned and the bill is referred to the House Committee.
Secretary for Health. Deputy President, I move the second reading of the Supplementary Medical Professions Amendment Bill 2025. The Supplementary Medical Professions Ordinance regulates 5 supplementary medical professions, that is, the physiotherapists, occupational therapists, optometrists, radiologists, and medical laboratory technologists. Under the ordinance, these 5 supplementary medical professions are regulated by the Supplementary Medical Professions Council, that is Council, and the 5 supplementary medical professions boards on the principle of professional autonomy. This legislative amendment has 3 purposes. The most important purpose is to recognize the increasingly important role played by supplementary medical professions in our local healthcare system. We propose to adopt allied health professions, which is commonly used to replace supplementary medical professions. The Supplementary Medical Professions Council will be renamed as the Allied Health Professions Council. To ensure our legislation is in line with the latest trends of primary healthcare and interdisciplinary collaboration, we make 2 proposals. 1, allowing direct access to physiotherapist or occupational therapist services without a registered medical practitioner's referral. And 2, allow allied health professionals to accept referrals from Chinese medicine practitioners. We hope to promote the participation of PT and OT in primary healthcare with a focus on degenerative diseases on the premise that patient safety is ensured. Members of the public are encouraged to make good use of the professional healthcare network in the district. The amendment bill, therefore, introduces various risk management arrangements. For example, PT and OT must provide treatment in accordance with the clinical protocol issued by the organizations prescribed under the bill, or the guidelines on interdisciplinary collaboration arrangements published by the Primary Healthcare Commission in the absence of referral from medical practitioners or Chinese medicine practitioners. Disciplinary actions will be taken against PT and OTs in the event of non-compliance with code of practice or guidelines. Meanwhile, we propose to allow patients to receive services of PT and OT on the basis of diagnosis made by a registered medical practitioner or Chinese medicine practitioner in the past 12 months, so that patients don't need to seek referrals in a short period of time, thus reducing the process and minimizing the cost. The amendment bill will devise a legislative framework to enable allied health professionals to accept referrals from Chinese medicine practitioners, covering those who provide services for patients under the governance of the Chinese medicine hospital and those who practice in the community. There is a practical need for Chinese medicine practitioners to refer patients for other treatments according to the clinical needs and to use modern diagnostic techniques which can help to enhance the accuracy of clinical diagnosis and monitor the effectiveness of treatments. In order to implement the referral arrangements in an effective and orderly manner, the traditional Chinese medicine profession needs to reach a consensus with the allied health profession on the required standards of knowledge, skills, professional competency, and conduct. Relevant professional codes of practice also need to be updated. In this regard, the Chinese Medicine Council and the boards of the allied health profession have started interfacing to prepare for the implementation of referral arrangements, with a view to benefiting the public as early as possible. In addition, to consolidate the manpower supply of local allied health professionals, the 2023 healthcare manpower projections show varying degrees of manpower shortage in the short run in the 5 allied health professions. The bill introduces a new avenue of limited registration to allow qualified non-locally trained allied health professionals to be employed by specified organizations to undertake specified types of work. The limited registration will be valid for 3 years and can be renewed, but will not migrate to full registration unless they have completed a local course recognized by the board or pass a practicing examination, in which case they may apply for full registration through the existing route. We will require employing organizations, including the HA, the DH, the Primary Healthcare Commission, the Chinese Medicine Hospital, and training institutions to give priority to employing locally trained allied health professionals. On a different note, This legislative exercise covers changes to the composition and structure of the Council and the 5 boards for better regulation of the industry and the promotion of interdisciplinary collaboration. There are also technical amendments alongside making continuing professional development a mandatory requirement for the renewal of practicing certificates. Much consultation has been done on various proposals. In September 2022 and December 2023, we briefed the panel on health services on the latest progress of amending the ordinance. In the second half of 2024, we started a new round of consultation covering 5 allied health professions: the medical profession, the traditional Chinese medicine professional, primary healthcare practitioners, and patient organizations. A total of 16 consultation sessions have been conducted since. This amendment bill has factored in the views from an array of sectors. I appeal to members to support the passage of the bill. The government will fully support the Council in its scrutiny of the bill. I so submit. Thank you, President. I now propose a question to you that the aforesaid bill be read the second time. In accordance with the rules of procedure, the second reading debate is adjourned and the bill is referred to the House Committee.
Secretary
Secretary for Transport and Logistics.